Hi, this is Mikke, and I'm going to show you how to administer the Oraquick at-home HIV test, since I think it's important that everyone gets tested, and since I'm excited for this product, since it's the first one that allows you to get tested at home without sending anything in. And let's see how easy it really is. I got this box at CVS. You can get it online too. It's about $40, and if you start reading at the back of this product, it says that it's an in vitro diagnostic home use test for HIV in oral fluid, so you're not allowed to use it or supposed to use it on blood, plasma, semen, vaginal fluid, urine, sweat, or breast milk, and you should only use it. If used, it's only effective if it's used 3 months after a risk event. So using this test earlier than 3 months, since the risk event may not produce an accurate result. When should I not use this test? If today is after expiration date on the outside of the box, if you're age 16 or younger. So it says here 2015-01, so I guess we're okay to go. So let's break the seal and open the box. I'm not a very patient person, so I'm just gonna break into the box. Okay, so out comes this very professional plastic box, and inside is a guide and a guidebook. So the first thing it says, a positive result with this test does not mean that you're definitely infected with HIV, but rather that an additional testing should be done in a medical setting. A negative result of this test does not mean that you're definitely not infected with HIV, particularly when exposure may have been within the previous 3 months. If your test is negative and you engage in activities that put you at risk for HIV on a regular basis, you should test regularly. This product should not be used to make decisions on a behavior that may put you at increased risk for HIV. Okay, so we know that. So let's go to the testing directions. Congratulations on your personal decision to test yourself for HIV. You must follow the test instructions carefully. And let's see here if we can stand here, right here. Okay, you're encouraged to read the booklet without a high-risk event likely the person having it is quite low. Getting ready for the test, you must follow the test instructions. Most people feel a bit anxious taking an HIV test, but if you feel very anxious about taking a test, okay, so it's just a repetition of that. Do not eat or drink or use oral care products such as mouthwash, toothpaste, or whitening strips 30 minutes before starting this test. Okay, I think I'm pretty safe there. Remove dental products such as dentures and any other products that cover your gums. No such things. Find a quiet, well-lighted place where you can be for at least 20 minutes. I guess I'm there. Always use these directions to help you read your results correctly. If you use glasses to read, you will need them for taking this test. Please make sure you have read the information on the back of the outer carton box. Yes, I've done that. Make sure you have a timer watch or something that can time 20 to 40 minutes. Okay, so my phone will come in handy here. It may be helpful to have access to a phone to speak directly with a support person. Let's begin. Oh, look fancy. It's like a drawer that slides up. And in there are the actual products. So let's see here. We have the testing directions, single-use Aura swab test stick, which should be right here in the seal envelope. Cap test tube with liquid, which essentially would be this, also sealed. HIV testing and me, a booklet about HIV prevention and support. Check right here. And what your results means to you, booklet about what to do next. So yes, I have that one as well. All right, and then I have an envelope. I'm not sure what I would do with this. I guess when I throw stuff away, maybe. We'll see. And a pen. Sorry, pencil. Do not eat or drink or use oral products for 30 minutes. Do not drink liquid in a test tube. Do not use this test if the test stick has been exposed to household cleaning products. And do not place the test stick in the test tube prior to swiping your gums. All right. How quickly will I get my results? You can read your results 20 minutes after your start. You must read your results between 20 and 40 minutes after you start the test. After 40 minutes, the results are no longer accurate. Okay. So let's get on. Open test tube. So the first thing I want to do is take out the packet labeled test tube. This. Tear open the packet to remove the test tube. Okay. Then it says, be careful. There's liquid at the bottom of the tube. Hold the tube upright. So do not twist. Okay. There we go. It's popped. Now I have an empty test tube. And I have a holder for it. So I put it in the holder. And if the liquid spills, or there's no liquid in the vial, the test will not work. There is liquid in the vial. Next, open the test stick from the same drawer. So this is the test stick. Let's open it. Do not touch the pad with your fingers in expedient collection procedure. So here's the test stick. It looks like this. It's got markings. It's got a swab. Okay, so let's check. Swipe gums. Make sure the timer is ready, but do not start it yet. So let's do it. Let's set timer for 20 minutes, but not starting it yet. Gently swipe the pad along your upper gums once and your lower gums once. You may use either side of the flat pad. Make sure you swipe each gum only once or your results could be wrong. Okay, this is not going to be pretty, but let's do it. So after I swipe, I'm just going to see what happens. So once I've done that, I should put the test stick directly into the test tube where indicated on the upper portion of the test stick holder, and write down the start period, time, and then timing. Okay, so I'm going to swipe. It's sort of like brushing your teeth, except you're brushing your gums. It's not very pleasant. Okay, I have it. I put it in. I'm starting the timer. So now I guess I just wait 20 minutes. It's in the tube. Let's see if we can do this in a good way. Right now it looks like this. So test tube and stick. I'm sorry that it's a bit shaky, and you're supposed to open this flap so you don't stare at the stick, I guess, and then afterwards you're gonna get a result. So I guess we're just waiting 20 minutes. Okay, 20 minutes have passed and it's time to look at the results of the test. So this is what the actual test kit looks like, and these are my results. So test tube, and as you can see, you're supposed to have a line at the C, but not at the T. That means negative result. If you can't see it here, you can actually see blog pictures in my blog as a post. But yes, this is not even, there's not even a faint line at the T. So I'm done with this, and once you're done, the envelope is actually to dispose of this. So I'll just put it in here, seal the envelope, and you can throw it away in the trash without worrying about someone finding it. At least not knowing where it is. All right, so that's how simple it is to use this test. I guess that the most nervous thing would be waiting if you suspect or if you've been involved in some high-risk activity. But it's actually really simple to do, to take, administer. And I think that if you are worried, you should definitely do it.